This is the radial nerve glide tensioning sequence. Remember our number one rule when we perform any neuromechanic drill, once we find our tension, we want to keep the intensity at a 3 out of 10 and not go any higher. Nerves don't like to be stretched aggressively, so we want the intensity to be a 3 out of 10. For the radial nerve, what you're going to do is lock out your elbow, take your thumb and flex it, and also flex the wrist. From here, I internally rotate at the humerus, and there's a little bit of what's called ulnar deviation. Think about taking the knuckle of the small finger and bringing it closer to the elbow. So it would look like that, just a very small motion, ulnar deviation. Once I'm into this position, I'll take the entire shoulder area, the scapula, and I'm going to depress it. At this point, personally, I'm starting to feel some tension through the forearm. As long as that tension is not higher than a 3 out of 10, I can proceed into the rest of the tensioning sequence. You're going to do a lateral tilt away from the target arm. And now I have a really good tension feeling through the nerve. I feel it coming up the forearm. You don't have to feel it to make this successful, but if you are at a 3 or a 4, that's appropriate. You can also abduct a little bit if you're not feeling the tension yet. Once you are under tension, you have a number of different options in terms of where you want to drive this from. You can drive it from the wrist, so I would make small pulses down here. I can drive it from the elbow. I can drive it from the shoulder. And I can even drive it from the cervical spine. Eventually, you might explore more than one driver for this drill, but at this point, if we have assessed which driver is the best one for you, that's the one that you want to use right now. This was the radial nerve glide tensioning sequence.